Are you taking Proscar for your prostate or Propecia for hair loss and experiencing sexual or mental health side effects? You're not alone. Have you heard of Post-Finasteride Syndrome and the ongoing lawsuits against the FDA for not adding boxed warnings? And did you know there's an increased risk of a serious type of prostate cancer linked to finasteride? In this video, I'll break down everything you need to know about this medicine, its impact on your body, and the potential side effects, so you get fully informed. Let's start at the beginning with what is finasteride. Finasteride is used to treat an enlarged prostate by helping ease your symptoms if it's difficult to start peeing, if you need to pee urgently or more often, or it's difficult to empty your bladder completely. And it can be used to treat hair loss in men called male pattern baldness. So how does it work? Finasteride is a type of medicine called a 5-alpha reductase inhibitor. It works by stopping a sex hormone called testosterone turning into another hormone called DHT. Ordinarily, DHT can cause your prostate to grow bigger, called benign prostate enlargement. It can also stop your hair growing. And so finasteride stops DHT being produced, and so this helps shrink your prostate and reduce hair loss. So who may not be able to take it? Finasteride is not suitable for some people. To make sure it's safe for you, tell a doctor if you have ever had an allergic reaction to finasteride or any other medicine. If you have ever had depression or thoughts about harming yourself. If you have severe bladder problems. If you have liver problems. And women, because neither the MHRA nor the FDA have approved finasteride for female hair loss, and this is mainly due to safety concerns including potential birth defects. So how and when do you take finasteride? For an enlarged prostate, the usual dose is 5 mg once a day. For hair loss, the usual dose is 1 mg taken once a day. You can take it with or without food, and it doesn't matter what time of day you take it, just make sure it's around the same time each day. Swallow your finasteride tablets whole with a drink of water and don't break or crush them. So how long does it take to work? You may notice an improvement a little while after you start taking them. However, for an enlarged prostate, it can take up to 6 months for this medicine to work fully. And for hair loss, you can expect to see some improvement after 3 to 6 months. So what are the common side effects? Impotence or erectile dysfunction, problems ejaculating or testicular pain, breast enlargement, decreased sex drive or low libido, dizziness or feeling sleepy, fast heart rate. So what are the serious side effects? That call your healthcare provider if you get a serious allergic reaction to finasteride. If you get any lumps, pain or swelling in your chest area or discharge from your nipples. If you have low mood such as depression, anxiety or thoughts of harming yourself. Now I want to delve into this in a bit more detail. Finasteride has been reported to cause depressed mood, depression, suicidal thoughts, and sexual dysfunction, including decreased sex drive and inability to get and maintain an erection. In some cases, sexual dysfunction has persisted in patients even after they have stopped taking finasteride. Now, this is called Post-Finasteride Syndrome. However, there is a lack of awareness of these potential side effects. Now, the Public Citizen filed a lawsuit on behalf of the Post-Finasteride Syndrome Foundation against the FDA for the inaction on a petition submitted by them in September 2017, asking the FDA to remove Propecia from the market due to evidence of serious risk of patient injury, including depression and suicidal ideation. So what should you do? So before starting finasteride, You should inform your prescriber of any personal history of depression or suicidal thoughts. Men taking finasteride 1 mg for hair loss who develop depression or suicidal thoughts must immediately stop treatment and contact their doctor as soon as possible. Those prescribed finasteride 5 mg for benign enlargement of the prostate who develop such symptoms should speak to their doctor urgently for further medical advice. Now, if you experience any problems with sexual function, such as an inability to get and maintain an erection or decrease in sex drive, you should discuss this with your healthcare professional. It's also important to tell your family or friends that you're taking finasteride and that it may sometimes affect your mood or behavior. This is so that they can help you notice any changes. And lastly, what's the risk of cancer by taking finasteride? In 2011, the FDA issued a drug safety communication alert advising that there may be an increased risk of a more serious form of prostate cancer called high-grade prostate cancer, even though this risk appears to be low. And in 2014, the MHRA issued an alert because there had been cases of male breast cancer that had been reported in the Proscar clinical trials and during post-marketing use with Proscar and Propecia treatment. The patients were being advised to promptly report to their doctor any changes in their breast tissue, such as lumps, pain, or nipple discharge. So the take-home message would be to discuss any questions or concerns about your medication with your healthcare professional and report any side effects that you may experience. I do have other videos specifically for men's health, including tamsulosin and Viagra and red light therapy for hair loss, which I will leave a link for below. Now, if you've had any experiences with Proscar or Propecia, please share your thoughts and stories in the comments below. And hit the like button if you've enjoyed this video, and don't forget to subscribe to our channel for more insightful videos on health and wellness that are released each week. Thank you for watching, and take care.